We're happy to have with us today Dr. Samuel Bederman. Dr. Bederman is an adult and pediatric orthopedic spine surgeon at the University of California at Irvine. He completed his medical school, residency, and PhD at the University of Toronto. He then went on to do 2 spinal fellowships, one at the Royal Adelaide Hospital in Australia, and the second focusing on spinal deformity and revision surgery at the University of California at San Francisco. He has published extensively and has delivered lectures around the world on the use of spine surgery and correction of spinal deformities. Currently, he is the medical director of Orthopaedic Inpatient Specialty Unit at the New Douglas Hospital at UC Irvine, Orange, California. His current practice focuses on robotic spinal surgery, correction of spinal deformities like scoliosis and flat back disorders, and treating problems after prior spine surgery. Welcome, Dr. Bederman.
Thank you.
Let's please talk about degenerative conditions of the neck and back. What are some common problems you see referred to the neck and back?
Well, these degenerative conditions are extremely common. We see them in everyone from young adults through adulthood and even into the elderly. And they comprise a number of different problems, but in broad categories we see problems either related to wear and tear of the joints or the discs, which cause back pain, or areas of nerve compression, which can commonly cause leg pain. In addition, we'll also see some conditions where the degeneration process continues in that the spine becomes somewhat unstable. There may be a slippage from front to back or side to side, like a scoliosis.
When is surgery recommended for these types of patients?
Well, fortunately for most of these conditions, non-surgical treatment actually tends to work quite well. Things like physical therapy, medications, and injections actually deals with most of these problems fairly well. When all of those things have failed to really treat the symptoms adequately, then surgery may be an option for some of these people. And in broad categories, there's really only 3 things we do. We either unpinch a nerve if it's being compressed, causing leg pain. We may need to stabilize a spine if it's a segment that's unstable and shifting from side to side. Or if there's significant deformity or loss of the normal curvature, we may actually correct that deformity at the same time.
Great, let's move on to robotic surgery. This is a cutting-edge technique that's used in some higher institutions here in America. What exactly is robotic surgery, and why is it useful in spine surgery?
Well, robotic surgery is really the use of an intraoperative machine that carries out certain tasks that we ask it to do. And it's relatively new in the field of spine surgery. What the robot does is essentially it carries out certain tasks, like insertion of screws if we're trying to stabilize the spine with hardware.
What exactly does this robot look like?
Well, the robot is not what you would think of as a normal robot with head and arms and legs. It actually isn't quite that impressive looking. It's about the size of a can of Coke. And what it does is it has 2 articulating plates, one that moves relative to the other. So what we really do is we take a preoperative image, like a CAT scan for instance, and using specially designed software, we superimpose onto that CAT scan exactly our plan and where we want to place all of our implants. During surgery, once we've referenced where the robot is sitting on the spine relative to the actual anatomy, it then carries out those particular tasks. So it moves into a certain position to target each implant where we want to insert. Now, the robot doesn't actually do the work, it really acts as an assistant. So it moves into a certain position and guides us and helps us find the normal trajectory or the angle and orientation which we'd want to put our screw.
So therefore, how has robotic surgery improved outcomes in spinal surgery?
Well, robotic surgery is helpful in several ways. One is it's been shown to be far more accurate than just putting in screws in a conventional way. So the accuracy is better, the chance of missing or being off a little bit is much less. The second thing is, because it only requires 2 X-ray shots during surgery, it reduces the amount of radiation. Conventional techniques typically require many images, many X-ray images in order to properly navigate and see where we're going. And the third thing is it can actually speed up the whole operative time. So it can speed up the procedure, it can make us faster, and can reduce a lot of the complications we see from extensively long procedures.
Great. Moving on to a much common spinal deformity and complaint is scoliosis and spinal deformity correction. What exactly is scoliosis?
Well, scoliosis itself is a side-to-side curvature of the spine. But in actuality, it's really a three-dimensional deformity where the spine rotates, and that causes a side-to-side curvature. We see it pretty commonly in children, but even in adults.
Is scoliosis just a childhood problem? Or can adults have this problem related to scoliosis?
Well, we see it quite commonly in children, but even in adults, if their spine has worn out a little bit asymmetrically, let's say that one disc wears out a little bit more on the left than the right, then that can cause an acquired scoliosis that we wouldn't normally see in a typical child. And so we see different types of scoliosis in children that we do in adults.
Is there an age limit to having surgery in regards to scoliosis?
Not really. We see scoliosis in everyone from little kids with congenital abnormalities through adolescents and even up until the elderly, particularly those that have had discs that have worn out or they've had fractures associated with osteoporosis and then develop scoliosis. Really, age isn't a cutoff for surgery. What's more of a cutoff, let's say, is their general health and their general medical condition.
Moving on to failed back surgery. Why doesn't surgery always work the first time?
Well, in most cases, surgery does work the first time. But unlike other joints we operate on, the spine always has another level. And to that end, there's really no definitive operation. Let's say we lock one level of the spine in together like this. The motion persists at other levels, and so those now have the opportunity of wearing out above or below. So there really isn't a definitive procedure on the spine, unfortunately, and so surgery can be successful for a period of time, but then over time other levels may wear out.
So then what are some common problems seen after failed back surgery?
Well, there are a number of problems. The most common is related to an adjacent level problem. Let's say a level above or below a prior fusion starts to wear out. And the disc can wear out, the joints can become arthritic, they can get recurrent narrowing or pinching of the nerves, or they can actually develop some deformity like loss of the normal curvature, flat back, or even a scoliosis. The other problems we see may be related to the levels that were operated on. So if they had a prior fusion, sometimes the fusion doesn't take and there's still perpetual motion. In those cases, the spine needs to be refused or reoperated on to get that to properly heal. And then some other less common problems are related to fractures or infections or recurrent narrowing around the nerves.
So with these problems, can more surgery ever help these patients?
It depends on the circumstance. In some cases, if there's an identifiable structural problem, like an area didn't heal properly, let's say that's been operated on before, or there's degeneration above or below, or significant curvature or loss of the normal alignment, then surgery is actually quite effective. If patients just have persistent back pain without an identifiable cause, then generally surgery is not recommended.
Thank you for your time, Dr. Bederman.
Thank you. It was a pleasure.